All right. So the topic for today is falls prevention. This is a really, really important topic, especially for seniors. So we'll talk about some risks for falls, some health consequences, but then also talk about some ways that you can prevent having a fall in the future, and also the way that you can use technology to help you stay as safe as you can. So just to note, this presentation is funded by RBC, the Government of Ontario, the Government of Canada, and Entente Education, which was formerly known as Retired Teachers of Ontario. So there's a couple objectives we have for today. These are the goals that I would like to achieve by the end of today's presentation. So first, I would like you to be able to understand why falls prevention is important for maintaining health, safety, and independence. I will talk about some risk factors that can lead to falls, as well as some tips for how to minimize them. We will learn how to implement safeguards to help prevent falls and really help you stay as safe as you can. And then finally, learn about some technology that can help if you've had a fall. So, falls are a really, really big and important topic. Falls are the leading cause of injury-related hospitalizations among older adults in Canada. And they're responsible for 89% of these injury-related hospitalizations, so almost 9 in 10. And these are stats from the Government of Canada. 1 in 3 Canadian seniors fall at least once each year. So it's even if it doesn't lead to a hospitalization, it is still a very, very prevalent occurrence. And unfortunately, we also see that falls are a leading cause of death among seniors, and these are usually related to health complications such as hip fractures and limited mobility. So it's a very, very important and very non-trivial topic, which sometimes it might seem to be. There are a variety of risk factors for falls, so I want to go through some of these. Now, before I go into them, I want to separate them into two different types. There's intrinsic risk factors. These are related to the individual, so related to you. And then there are extrinsic risk factors, which are related to the environment that you are in. Okay, so those are the two types of the sources of risk. So first, talking about intrinsic risks. The first one are age-related changes. So as you age, there are certain things that your body goes through that results in your risk for falling to change and to increase. The first is reduced balance. So your sense of balance may change. You might feel off balance more often, or you might just feel that when you are balanced, you aren't actually fully upright. But you almost also might have just reduced balance overall. So you might not be able to catch yourself as well. You might not realize that you are falling. Reduced muscle strength is another factor. So you might not be able to support yourself upright as well. And so this reduced strength can lead you to not be able to catch yourself as well. And then very closely related to that as well are slower reflexes. So whereas before, even if you did have poorer balance, if you had quicker reflexes, you could catch yourself before you fell, or at least try to cushion your fall a little bit. With age, your reflexes may slow down, and so this may really prevent you from being able to catch yourself as well in case of a fall. So all these three together are those kind of age-related changes that often, you might only have one of these, but you also might have two or three of them. And so when they occur together, that might really increase your risk quite a lot. Medical conditions can also have an effect on your fall risk. Stroke can impair you either cognitively or physically, and so this may impact your balance. Conditions such as arthritis may also make movement more difficult, and so you might not feel as fluid in your movements, and this might affect how well you can move through an environment. And with arthritis, you might have more of a risk for falling. In terms of cognitive impairments, dementia and Alzheimer's can cause effects on your balance, and they can also affect your fall risk. Parkinson's disease is a big one. With the tremors that are present in Parkinson's disease and other physical complications, these might cause you not to be able to stand as well or to move around the same way you would before. And then finally, diabetes can also have certain impacts, such as peripheral neuropathies or other conditions where you might not be able to feel your extremities as well. Then, if you take any medications, even for medical conditions unrelated to fall risk, the medications themselves may pose a risk for falling. And so this would be any medications that can cause either drowsiness or dizziness, since this would affect your alertness or your ability to stay on balance. So just when you get any medications, just check through the side effects very, very carefully. Um, I know those sheets are usually quite large, but just read through them very carefully to see what all of the different side effects are so that you know that if you're taking potentially a drowsy medication, that you just have to be extra careful when on it when you're moving around. I also would recommend checking with a doctor or a pharmacist, since sometimes medications can impact each other. So if you know you're taking two medications that on their own don't cause dizziness, but together they might, it's good to talk to a doctor or a pharmacist to see if this might be the case before you begin any new medications. And then finally, foot problems can also, of course, pose a risk for falling. Wearing poor footwear. So you really want to find shoes that are comfortable, but also tailored to your needs. So you might need thinner soles or thicker soles, depending on what's best for you. As I mentioned, neuropathy can have an effect on this. And then just general foot pain. If your foot is in pain, you're probably not going to be walking the same way. You might be trying to avoid putting weight on the foot that hurts. And this can often throw you off balance and, not make you walk the way that you usually do. So parallel to these, there's also extrinsic risks. So for home hazards, you really want to be careful about the way that your home is set up, and there's a lot of things that can get in your way. Things like loose rugs, if you have a rug that moves around or potentially might be curled up at the edges, these can pose trip hazards or can slide out from underneath you. So you really want to make sure that your rugs are quite secure. Any clutter that's around. And this is quite tricky because, especially if you've had this clutter for a while, it sort of blends into the environment and you might not really see that it's there. But that can get in the way. And especially if some things shift around or move, you can trip over them on your way through a particular room. Low or poor lighting can make it hard to see certain obstacles, including the clutter or those loose rugs that I talked about. So you really want to make sure that any places where you're walking through are quite well lit. Slippery surfaces, if you have certain tiles are very, very slippery or related to the rugs, certain little rugs at entryways can be quite slippery, especially if the backing to them is worn off. So just be very, very mindful of those and try to cover them if you can. And then related to clutter is a lack of clear walkways. So you might have some boxes stacked up, but you really want to make sure that there's a clear way for you to get from one room to the other without having to step over things or move things aside. And you want these to be as wide as possible. So even wider than you are, so that in case you have to move to the side, you aren't tripping over anything. Stairs are a really big topic for falling. You really want to have a laser focus on what your stairs are like in order to minimize fall risk. Check your railings. Check to make sure that none of the railings are missing. So the actual grab bars that you can hold on to, but also ones that are unstable. So I would go through if you do have, one of those railings along your stairs, that you would just check every single one of them to make sure that it's nice and stable, so that in case you do need to grab onto it and put your weight on it, it doesn't move around or come out from where it's installed. With time or poor installation, certain steps can be uneven. So just take a closer look at your stairs and make sure they're not sagging in the middle, they're not at different heights, and that every step you take is the same, so you don't get any unexpected differences in height. And then finally, slippery flooring materials, so things like hardwood or sometimes even tile stairs can be very slippery. So think about installing a well-secured runner, or maybe if you're planning on redoing your stairs, using a less slippery material. There are a lot of outdoor risks. We're getting towards the end of winter now, but this is still very prevalent. Ice and sleet, of course, are a huge, huge issue. Especially at this time of year, black ice is a big concern where you can't really see it. So just practice extra caution when walking outside. And if you're really concerned about falling, try to minimize the amount that you're walking around and going outside. Certain sidewalks can be uneven, especially with freezing water underneath. This can shift sidewalk tiles during the winter. So just be very careful about where you're walking and look to see to make sure that the sidewalk is even where you're walking. And then there's also just general poor weather conditions. So rain during the summer or fog or other conditions that make it either hard to see or harder to navigate the places you're walking through. Assistive devices are usually a great help against falls, but they can also sometimes pose a risk. Canes that are fitted improperly, so ones that are too short or too tall for you, may not really provide much benefit, or other mobility aids such as walkers. If they're not working well or not installed properly or not tailored to you, they can actually pose more of a fall risk and can make things worse rather than better for you. So a couple tips for preventing falls. First is, and this is all from the Mayo Clinic, these tips that I'm presenting. So first is you want to make an appointment with your doctor and discuss a couple different things that can pose a risk for falls to you. So first, as I mentioned before, your medications. These might have side effects either on their own or in tandem with other ones that you take. So bring a list of all of the medication that you take. Your doctor can look at the side effects to these and tell you about which things may cause an increased risk for falls, but they can also make an adjustment. So they can swap out with a different medication that may not have that side effect, but a different one. It's also good to talk about your previous falls. So make a list of all of the previous falls that you've had and be very, very detailed. So think very carefully about when you've had each fall and include details. So when, where, and how you fell. And so just be as detailed as you can, but also include near falls. So things where you kind of tripped a little bit, but were able to catch yourself, since these are important too. This can give your doctor a sense of what are the common factors in your fall. So were you in the same place each time? Were you doing the same activity? Other common factors that then you might want to adjust in your environment, or, intrinsically on your own that then can prevent you from having a fall in the future. You also would want to discuss your health conditions. So as I mentioned, many health conditions may increase your risk of falls, even ones you may not expect. So beyond the ones that I've just mentioned today, focus especially on eye and ear disorders. Eye, since this affects how well you can see your environment, and ear disorders, since they can affect your what's called your vestibular system or your balance system, which is located in your inner ear. You also would want to discuss how comfortable you feel walking around and any sensations that you feel when doing so. Things like dizziness, joint pain, shortness of breath, and numbness, since this can give your doctor an idea of how you feel and what things you can do to prevent falls. Your doctor may also conduct a physical assessment, so they may test these things in the clinic, and so that'll give them a better idea of how you're doing. The next tip is keep moving. So risk of falling doesn't mean that you have to stop moving entirely. In fact, continuing to move is actually very, very important in maintaining your physical strength and your balance. And it's also just essential for your health and mental health overall. So risk of falling does not mean that you must stop moving. However, you want to be careful or intentional in the activities that you choose when you do continue moving. So I recommend that you consider activities such as water workouts or Tai Chi. These are quite low impact, low risk activities that can help with improving strength, balance, coordination, and flexibility. And with things like water workouts, there really isn't any fall risk there. And especially if you have someone with you, that'll be an extra safeguard. Your doctor can also recommend some safe activities, so they may have some ideas of what things you can do that are good for your physical activity level, but also safe. And then consider joining a carefully monitored exercise program or seeing a physical therapist, since they can help support you with staying active, but also being safe. So I want to talk about wearing sensible shoes. This is another big thing. So you would want to avoid Things like high heels, floppy slippers, shoes with slick soles, so ones without much of a tread or with not as a grippy material, or walking just in your compression stockings or socks. These can all really increase your risk of falling, and they're just harder shoes to navigate in, even if maybe some of them look nicer or are more comfortable. Um, but I would instead ask that you choose shoes that fit properly. So they're really your size, your foot doesn't move around too much, but also isn't too snug. Ones that aren't too sturdy. You really want ones that can flex with the environment, that you can really feel where you're walking. Choose shoes that are flat, so you're more stable on the ground. And finally, ones with non-slip soles. And you can find ones that advertise this because the sole material is made for extra grip, especially ones during the winter. And actually, following these tips can also help reduce joint pain. So, not wearing things like high heels or floppy slippers or just poorly made shoes can help you reduce joint pain when walking, which then can again decrease your fall risk. So, there's those two factors at play there. You would also want to remove home hazards. So, just some tips for this. Find your walkways where you move through your home, especially ones you use frequently, and clear them of any boxes, newspapers, cords, other clutter. Really have them nice and clear so you can get through them as easily as you can. Move any coffee tables, magazine racks, and plant stands and so on from high traffic areas. So even if they're not in the way directly, if they're just somewhere where you're moving around a lot and they may get in the way, move them somewhere else. So move them to a room that you use less often, or just put them somewhere where they're not in your way. So loose rugs are a big factor. So either secure them with tape or tacks, or just replace or remove them entirely. As I mentioned, the backing of certain rugs can harden or peel off with time and make them not non-slip anymore. So if that time has come, invest the money and replace the rug with a newer one. If you have any loose flooring or carpets, repair this right away. So really don't take extra time. You might at first remember that there's a certain floorboard that sticks up, and you might remember and avoid it, but eventually you might forget and you really don't want to trip on it, especially not at night, or when you're just busy doing something else. So as soon as you get this issue, repair it as soon as you can. Store necessities within easy reach. So if there's a certain thing you need and it's in a top cupboard that you have to really reach for or stand on a chair to get, even if it's been there for years and you're just used to it being there, consider moving it somewhere else where it's easier to get to, especially if it's something you're reaching for very often. If you spill any liquids, grease, or food, clean this right away. Pause whatever you're doing, even if you're cooking, and just spill it. As I mentioned with the loose flooring, you might remember it a few times, but you may get caught up with whatever you're doing, forget, and you really don't want to slip on it when you're walking around. And finally, use non-slip mats in your bath and shower. So especially if you've got those, I think pretty much all baths and showers are quite slippery, either if they're, a metal or a tile one. So consider installing some of these mats that can provide a bit of extra grip. Next, you want to make sure you light up your living space. Keep your home brightly lit. This doesn't mean using those awful overhead lights if you don't like using them. If you like ambient lighting, that's fine, but just install a lot of it and ones that are bright. You can still have the nice warm lights, but ones that are just a little bit brighter, since this can help you see a lot better, what's going on in your place. Place night lights in bedrooms, bathrooms, and hallways so that you can clearly see where you're walking. Um, you can have ones that are light activated, so they only turn on at night and they do so automatically. You can just pop these in a bunch of different places and they'll all turn on at night. Place a lamp near your bed, so like on your nightstand or on a shelf, that you can use when you get up during the night. And so, even if you've got the night lights, this can really help you navigating the area right beside your bed. Make sure all of your light switches are accessible. So you don't want to have to be really reaching over something to get to a light switch, since you're not going to see the thing that's in front of it in the dark. And the only thing riskier than kind of awkwardly reaching over to a light switch is doing that in the dark. So you really want to make sure you can easily reach all of those switches. There are now light switches that are glow in the dark or illuminated. This can make it really easy to find in the dark. I would strongly recommend trying some of these out, especially in your bedroom. This is a huge one. Turn on the lights before going up or down the stairs. This is really, really important. Stairs are a big, big factor in fall risk, and turning on the lights can really help you prevent falls. And then finally, store flashlights in places that are easy to find. So buy a pack of like three or four and just store them around the house, in the kitchen, in your bedroom, in the basement. So in case of a power outage, you can just find one of these really close to you, flick it on, and navigate around that way. Really use assistive devices if you need. So if you've realized that walking unassisted or unaided is a risk, look into some good assistive devices. Your doctor can recommend either a cane or a walker, depending on what's best for you. You want to install handrails on both sides of stairways if possible, so that you can hold them with your dominant hand going both up and down the stairs. If you've got wood steps or other slippery ones, install non-slip treads or runners to help keep these extra safe. Consider using a raised toilet seat or one with armrests. This can help you sit down and stand up a lot more easily. So a lot of falls may happen either when you're sitting down or standing up. So both of those can really help. Install grab bars for a shower or bath, especially one that's a step over one where you have to, like a combined one where you have to step over to get in. A grab bar can really help keep you stable when doing so. And then consider using a sturdy plastic seat for the shower or bath with a handheld shower nozzle so you can shower sitting down and not get yourself too fatigued. Okay, so those are my tips, but I want to also talk about how technology can help with falls. So there's a variety of devices and services that can help with and are sometimes specifically designed for falls. So I want to focus on three specific ones: medical alert devices, smartwatches, and voice and home smart home assistants. So medical alert devices are the most low tech of the three. These are basically simple bracelets or sometimes necklaces that have a little thingy with a button on them. Um, so if you have a fall or you feel unwell or you need help, you just press it and this contacts emergency services. Some more advanced models may have automatic fall detection, so they may detect if you've fallen and place that call, and some of them may have GPS so that you can be found. Um, but there are some very, very basic ones that all they do is just you press the button and it makes the call. Smartwatches take this technology a little bit to the next level. So they are like a medical alert bracelet, but more advanced. And so they combine a watch, a fitness tracker, and a communication and safety device in one. And some of these will also have automatic fall detection and GPS. For these, when they detect a fall, will prompt you. So they'll say, it looks like you've taken a hard fall, and they'll offer you to make an emergency call. But what's nice is that they'll also make that call if you don't respond. So if you're unconscious or you just can't swipe or press the button, it'll make that call if it doesn't get any response from you, which is quite nice. So smartwatches are a piece of tech that I really strongly recommend to a lot of seniors, especially if you've got a risk for falling and you know that. I would really strongly recommend spending the money to get one. When buying one, I would make sure to get a model that does have these fall alerts. Not all of them do. So before you buy, just make sure that your watch does have this feature. And it can be worth spending a little bit of extra money to get it. It really, really is worth it. Plus, they can do a lot of other stuff like the fitness tracking, which can help you stay active as well. So, smart home and voice assistants play a big role in fall prevention, or at least helping you after a fall. So, these are devices that you can control with your voice. These devices are things like Amazon Echo, or better known as Alexa, Google Nest Hubs, which are those things you say, "Hey Google" to, or Siri. And so these allow you to use them without having to be near them. They can be either a physical device, so one of those hubs that just sits on the coffee table, or it can be an app or program on your phone. And you can get help when you don't have a phone nearby. So for the best fall protection, I recommend getting a smartwatch that you wear on you and a voice assistant. so that you have two layers of protection. So in case you fall and you don't have your phone on you and you're not wearing your watch, you can verbally say to your assistant to make an emergency call or to call a family member who can then get help for you. So, which option is right for you? Here are some key factors to consider. First is your health status. So, straightforward devices may be better if you have mobility issues, cognitive impairments, or chronic conditions. It might be best to keep things simple but straightforward. Think about your living environment. GPS tracking and higher range may be better for those living alone or in multi-story homes because then it can make it easier for people to find you. And then some people just might prefer more simple devices, and others might be more comfortable with complicated ones. So when picking one, make sure that you're getting a good level of complexity since you really want to be using the device and getting the most out of it. And then finally, consider your budget. So these devices will have different prices. So you really want to think about what that price means for you. And you want to consider both the upfront costs, so the cost of buying the device, but also any subscription fees that might come in. So the initial cost might be quite low, but you have to subscribe to some program and pay each month every time. So keep in mind both of those things. So I have some recommendations based on needs. So for active seniors, a smartwatch with fall detection offers both mobility and health monitoring. So that's quite nice. It has a combination of both. And as I mentioned, moving around is very important for preventing falls. So that's something to keep in mind. If you are unfamiliar with technology, a medical alert device, so one of those simple ones, really provides just the basics. It's simple to use and it's quite reliable. So if you feel intimidated by more advanced tech, that's what would be best to go with. If you are budget conscious, there are smartphone apps that you can get that can use your existing resources. So the app might be free, but it has certain voice commands or other things that you can make use of without having to pay at all. And then if you are worried about any cognitive impairments, anything like dementia, Alzheimer's, and so on, keeping it simple as well can ensure immediate assistance without the need for much interaction. All right, that is all I have. Thank you so much for coming today. Hopefully these tips can help you. Really try to implement them as much as you can and prevent falls as much as possible.